You can do it?
Yep.
You want to do your Hassan helping you?
I
Come
did
on.
my
Come on, do it.
T11, T12 spinal cord injury complete, and it happened in Bali. When I was in the hospital, someone said that they knew of an acupuncture, and David used to be at Randwick, so that was close to Prince of Wales Hospital. And when I rang him, he said he was at Warunga, and my daughter and I said, well, we'll come over and see you, and he said that he could help me. So I've been coming since, I think, at the end of November, last week in November. So, and it started off just once a week, but now I'm coming 3 times a week.
And what are you expecting the outcome will be?
I'll be able to walk again. Yes.
He's told you?
Yes. So, yep. Okay. He said slow progress, but we will get there.
Thank you.
Okay.
You going in?
Yeah.
JB have a holidays, go to Bali, Indonesia. And then unfortunately he got an accident and then hit to his here and then causing complete paralysis. So quadriplegia. And this is a paraplegia. Okay. Now you can see that operation. You see this scapula here, from scapula to here, that level they call T7. Okay, T7. And now this the bottom section here, this is a sacrum. Okay? And sacrum, on top of the sacrum is lumbar vertebra. Okay? So lumbar vertebra. So the lumbar vertebra, fifth of lumbar vertebra is my fingers here. Okay? So this operation up to here, just 1 vertebra, 2 vertebra, 2 lumbar vertebra above. Okay? 7 thoracic vertebra. All this area is operation cut. Okay, so that cut from T7 to lumbar 3. Understand? 5 lumbar vertebra below 2, no scar, are far more flat here. And this side, like this. This muscle contraction like this. Okay, now this flat. Because of I did very serious treatment, I want to make her recover quickly. And also because this complete transection lesion of the cord, if you do not quickly, earlier, to make this nerve remain that not yet dead, that nerve tissues recover, you waste that time and this finish. Muscle here still have something here. Okay? But now you can look at again. This leg, no any resistance. I take it up. If I put it down, it just drop. Okay, you see that? He have no any resistance because that nerve completely finished. Okay, so if he have any injury or damage, and that tissue is very difficult to heal. Okay, and you can see this muscle already at the flat down. So this muscle very weak, and then quickly will atrophy. Okay, atrophy. And if you put your fingers here, okay, the temperature here and here is not the same. Here warmer than here, okay, and here cooler than here. It's cold, completely cold. Even a hot summer, here is cold. So from the knee down to here, all is cold. and particularly both feet. Okay. Now you can see that needle stimulate to the receptor. Okay, should be stronger than hand, but that because that receptor is in the skin. So if in the skin, I use my fingers like that, and that stimulation also quite strong. Okay, just only different type of stimulation. Different type of stimulation. Okay, so therefore, if I use my fingers, okay, I use the needles, after needles, use my fingers, bring the nerve, continue going, okay, and that will be much, much better, okay. And the red color show warmer, okay. Now if I feel now is this temperature, after needles, if I will feel different temperature, because that will make that blood circulation and that nerve recovery, okay. But Chinese, they believe, and the blood and the nerve have that connection. So they said that blood circulation and the nerve, like one is a mother, one is a son. So they call mother and son correlation between mother and son. Mother is blood, is nourish the son, so the son will walk again. Okay? I pinch the skin out, and the needles get into this, over the skin, into that connective tissues. Okay? And that connective tissues sometimes is include the fascia. Okay? Now, after needles, you can see that needles make the mark like this, okay? So after needles, I use my fingers, move this, can enlarge that result, what the needle's doing, okay? It's the same, I pinch this up, and the skin and the muscle and the connective tissues, they are losing. They're not like this. If they have adhesion, the blood circulation become difficult. But if I do like this, okay, after needles, and use my fingers to it, and then you will get that result even better. Okay? So, if I follow this method, do it, okay, I will very quickly achieve that result. Okay? And then if you put the fingers here, and then you can feel completely different to here and there. And then they bring the blood circulation. If the blood can circulate, and they can nourish the nerve, and the nerve will keep growing. Okay? So they're mother and son, okay? So that Chinese, not necessary, they go to scientific, okay? But they're very practical and easy to remember, okay? So sometimes the students study acupuncture, they feel much easier to remember that the scientific explanation. Okay. Now you can see all the blood vessels here. Not only the artery difficult to go down, even the vein difficult to return. Okay, so I had to make a lot of bruise here, but that doesn't matter. Why? Because when needles stimulate to the vein and also give that body a stimulation, because that vein, the wall of the vein, can have that receptor, and that receptor, when needles go in, and that feeling like a electric shock for normal people. Okay, so you understand, if I break this, become a bruise here, it's not make any harm for you, because that bruise only superficial. That break, that vein is on the superficial, so that will provide far more strong stimulation than only stimulate to the skin. Now let me show you another Chinese trick, okay? You can see after I punch, you can see the color, okay? That pinch color, okay? Far more stronger than needles or fingers pinch, because that punch, the skin, and very strong. You see. See that? Okay, you can see these two different colors. That's because here, that circulation better, and this circulation very bad. So the color here, that light pink, that's a dark pink. Okay, if here, I spend more time, but the color is less than this one. Here, I just 2-3 punch, enough to make like this. And here, I have to more punch and make color like this. Okay, from here to here is different. I still need to have some needles in here. You know that when I punch needles, punch to the point on plantar, very painful, right? Anybody have one punch, the second time they will tell me, Dr. Toy, excuse me, no, okay, because they're very painful. But you can see this patient, okay, how I do it, nothing happened. Okay. That's nothing happened at all. But look like that needles, I didn't use my hand to do other things, but the color, you see the color? It's a wonderful color. So that still telling me this still with this color is similar to this color, better than this color.
Mm.
car accident. Yeah.
Yeah, it's your back's damaged.
My neck. Yeah, C6 and 7. So yeah, it's pretty high. The hospital wasn't really doing anything positive, I suppose. So I just figured, yeah, I don't know, I just started doing some reading on different ways that could make me get better, I guess. And acupuncture just jumped out for some reason. And then, yeah, I just, from a few people, sort of got, I guess, referred to David, who's guru of this type of thing. So,
And you've
Yeah.
been coming for a couple of months? Or?
2 months? 2 months?
Right?
2 months or
Yeah,
something?
yeah. Just start from this beginning of this year.
Mm.
Because he is incomplete transverse lesion of the cord, so part of the muscle still contraction, and that contraction is spasm, and sometimes make him pain, and sometimes make him frightened, because like that, suddenly like this, and then you have to hang on the wheelchair. Today, he have one man throw him up to the table. Ben, okay? Ben, he have C6, that damage in C6, okay? And he have operation not on the back here, mostly that operation on his neck, okay? And you can see from here, because they're very important to look at, this C6, T1, okay? T1, this area, start to look at the vertebra, is not out of the position, okay? And then T1, T2, and then from here, curve to another side like this, okay? Curve to like this. So from T3, start curve to nearly T7. So the vertebra curve very badly here, because this side the muscle give contraction. So pull this vertebra to this side, okay? But you can see now that curvation is less, because this, after that treatment, already release all this muscle contraction, make the vertebra turn to better position, okay? But if after I do treatment, make this muscle stronger, and then both sides will equal, and then keep the vertebra, keep the spine on the straight position, okay? You see this leg, okay? If I move this leg, he have a resistance, you see that muscle? He didn't want, because this muscle immediately respond, because his spinal cord not totally damaged. So therefore, part of the spinal cord still working, okay? You see this side? It's not the same as this side, okay? This side, you have to do very hard, and immediately the muscle contraction. This side, you see, like this. So this side, you remember that action? And because he had this lumbar vertebra, not much damage, okay? So therefore you can see this muscle tone not bad, okay? You see this muscle tone very good, but only this one a little bit weak, okay? So therefore can easily bring this muscle turn back to position, and everything be good, okay? So that's why I brave enough to promise Ben, I will let him, okay, before November, he will stand up and move. Now Ben start from her feeling is from thoracic 1, 2. Below that, he do not have much feeling, okay? But now, you can see now that feeling already happening here, okay? Okay, so everyone can see quite clear because that needles already provide that landmark, and you can see exactly where that vertebra, okay? Feel okay?
Mm-hmm.
Not cold?
Mm-hmm.
Thank you. Very good. Now you can see quite clear because I put the needles just on the side of the vertebra.
Mm-hmm.
So this three is on the line, okay? But this go down to here, but not necessarily on the line, because this another one is here. See that? It's in here. This one here, and then from there, curve here, and then curve there. So that damage series just in here. See this vertebra? Because if that needle can get in, just mean not touch to the bone. If I touch to the bone like this, the needles couldn't get in. Okay, so that's mean from here. You can see 1, 2, 3, good, and that go there, and that go back here. So this section very difficult. Have to correct back to the position. Very important, because if I do not correct this section, then they will become a big trouble all the time. Okay, now look at this section, okay, and that's wonderful here because that vertebra already turned back. not necessarily straight line, but at least not curved like this. You see the land needles make a landmark. You can see here, not this, but here. These needles to these needles is flat. Okay. So that lumbar vertebra, not much trouble from T12 to L5. Just only here, already slowly, already turn back to position. I just have to continue release all this muscle tied up and try to strengthen back the muscle this side, and then can make that equal. And look at this side. Okay. Wonderful. Much better than this. And also this leg straight and that leg curved to another side because this muscle is not the same. And quite clearly he left this bottom much easier both sides. Okay. feel something?
Mm-hmm.
Wonderful. If I do like this, it's better, right?
Mm-hmm.
Feel more.
Yeah.
As slim, stronger, and you see the color different.
Yeah.
The more red color is more blood supply, and the nerve will grow quickly, and then allow this muscle getting stronger to balance this, and then maintain this vertebral in the position.
Okay.
Yeah, you can go.
Go. Good.
Now you try to move your thigh. Come and see how far you can. Wonderful. Try again. Okay. I'll give you a bit higher. Try again. Do it again. Yes. You see that as far as you can do. Okay.
Mm-hmm.
Try one more. Wonderful. That's it. Okay. So now it's at July.
Mm-hmm.
When you start able to do this? June?
June.
From June, and then you can move a little bit. Okay?
Mhm.
And now you can move a bit more now, right?
Yeah.
Yeah, now you can move a bit more. Later on, you can move even more. Okay? Now move again. You can see start from here. Yes, you see? Yes. This leg moves better than this leg.
Mm-hmm.
Come, you look at it again. Yes, you see, this leg move higher than this leg. Okay?
Mm-hmm.
Now you can slowly move a bit more and more, right?
Yes.
Wonderful. That's it. You see, you can turn.
Do you want me to turn?
Yeah, you see, how can you help watching?
No,
She's
she's right.
No, watching, don't fall down.
He won't let me fall.
Okay, you see, wonderful.
And I can take it back too.
Yeah.
And lift this one over. Do you want me to lift this one?
Yeah. Lift this one. Oh my God, that's excellent. You see, excellent. Wonderful. Because you see, oh my God, you see how beautiful your mother. So if you can move like this, you can stand up and walk easily.
Mm-hmm.
Okay, you remember your complete transection listen of the cord from the lumbar, okay?
Yep.
And then never able to walk again. But
Mhm.
now you can move.
Yep.
Alright, my pants are kind of falling down. Is that alright?
Do you need a hand?
No, I'll just probably see my. Yes.
Yes, that's it, Ben. You did very well. You see your leg still spasm.
Yeah.
Okay. Left, right one.
Yeah.
Yeah. Right one still spasm. But you move much easier than before.
Yeah.
Yes. Wonderful. A little bit more. Yes, yes. Okay, okay. That's it. That's it.
Should have worn different pants.
Just because. And then not take off the clothes, just keep your clothes on.
Okay.
Okay.
Now, did we fold the bed up, like the cover? Yeah. I don't think I'm too far from it now.
You need the chair a bit front.
Yeah, what do you reckon?
Come on, do a
I
bit.
don't reckon. Pardon?
Or move this side.
Yeah, a little
Wait,
bit.
wait, wait. Oh, that, why you make it even?
Yeah.
No, a little bit more, a little bit more.
Nah, I think,
It's okay?
yeah, yeah.
Okay.
You right? Yeah.
You can do it.
2,
Go
3.
on. 1 second, 1 second. Just take a breath. Okay, now, come on.
Ready?
Up. Wonderful, wonderful,
No. I
wonderful.
lost it. I've lost it.
Now. 1 second again, 1 second again. Just wait 1 minute. Yes, yes. Yes, yes, yes. Okay.
You right?
Wait, wait, wait. Wait 1 second. Okay. Maybe you can do it. Come on. Yes. Come on. Your hand stand. Yes, yes. Yes, now you are okay now.
And the shoulders are back.
Yes. Yes, it's okay.
Yep.
Yes, that's it. You don't need to hold on the leg. She can do it. Come on.
This knee keeps
Oh,
collapsing.
yeah, yeah. Just stay. And that's all.
I
Okay.
don't feel real
Okay.
straight. I've got to straighten
No,
myself.
no, no, it's okay. 1 second. That's all. You put it back. The chair, come on. Come on.
It's all right. I'll go forward.
Yes, yes. Okay. Now that's all. Now this chair, put to the chair.
Oh.
No, no. You do this.
Yeah. Yeah.
Oh.
That wasn't very good.
No, no good. Doesn't matter. Just tell the truth.
Well, it wasn't very good. I did
Oh,
that.
because that need the progress.
Oh.
When time, a bit more time,
Yeah.
you will do better.
Yeah.
So this, you can do like this, already one big improvement for yourself.